It gives us great pleasure to welcome you here today to the 2024 MLHD Annual Public Meeting. This meeting is an opportunity for us to share with you our strategic direction and reflect on our achievements over the year. To begin our meeting, I'd like to invite Aunty Cheryl Penrith to deliver our Welcome to Country. Thank you.
Thank you, Adrian. Yuridu Marang, Nadu, Cheryl Penrith, Warachi Yina, Gawai Ambana. G'day everybody, my name's Cheryl Penrith. I'm a Warachi woman. Welcome. Welcome to Warachi Country. Welcome to Wagga Wagga. Welcome here today to the annual public meeting. For Warachi people, a really important value is Yinjamara, which is respect. So respect for yourself, respect for others, and respect for country. Welcome to Country is a protocol that's been performed for thousands of years. It ensures people's safety when they come onto country. It's a responsibility that's also reciprocal. So I think when you come onto country, sometimes people will say, you're welcome to come, but don't go there because that's a women's place, or don't go there, that's a man's place. But, we live on a river here, which is a pathway for people. So I think a really good way of thinking about it is follow the river. You'll always have something to eat, some shade and water. So I think that practice over thousands of years is really important to continue. I'd like to acknowledge my elders past and present. I'd like to acknowledge people that are watching via live stream in all of the places where MLHD have a footprint. So Uncle Stan Grant tells us that the true Warachi meaning of Wagga Wagga is a place of big celebration and dance, and I think every time we come together to have a yarn and to sort things out, I think that's a real celebration. Yes, I'll acknowledge if we got some elders watching, other First Nations people, but I acknowledge everybody here. I think I welcome, I'm really excited to be here today. So Gawai Ambana, welcome to Warachi Country. Thank you.
We'll acknowledge Aunty Cheryl, one of our board members actually, and thank you for your welcome. My name is Adrian Lindner and I'm the proud board chair for the Murrumbidgee Local Health District. It is a pleasure to stand before you today and share a strategic overview of our district and the exciting direction we are heading towards for the future. For those of you joining online today, you will notice the opportunity to enter your questions into Slido. We will be monitoring this over the course of the meeting and will endeavour to answer your questions during question time at the end. The Murrumbidgee Local Health District Board oversees the performance and progress of our services and facilities. We develop the strategic plan for the district and ensure it is carried out. Our current plan runs from 2021 to 2026, so we're midway through implementing it. Our board is dedicated to future-focused vision, drawing insights from the broader health environment to guide our local strategy. I want to extend my gratitude to our board directors for their unwavering commitment, leadership and strategic foresight. I truly understand our future direction. It's essential to reflect on several key reforms occurring at both state and national levels. On our board site visits, we often hear from staff about how much they enjoy the people they work with. A positive work culture is so important. Teamwork and people working together creates improved experiences and outcomes of care. We know that the experiences of our patients, their families and carers are closely tied to the experience of our staff. Like other sectors in regional New South Wales, we are facing workforce challenges. MLHD continues to offer the Rural Health Workforce Incentive Scheme for recruiting clinical staff, with a strong focus also on retention. The retention rates for medical officers, allied health professionals and nursing have all increased compared to the previous year. The 2023 People Matters Employee Survey indicated key factors affecting retention, including career opportunities and skill development. To address these, MLHD is focusing on a Years of Service Recognition program, also Manager Essentials Training and flexible work arrangements and employee wellbeing initiatives. Over the full year 23-24, MLHD successfully recruited a total of 2,756 staff, including 90 recruited from the UK and Ireland overseas. MLHD has a strong and successful school-based traineeship program with a grow your own model at the heart of its inception. This includes a focus on Aboriginal and Torres Strait Islander student engagement and employment into healthcare careers. It has a holistic and supportive approach to participant completion of the program and beyond. Currently, we have 41 trainees, with 10 identifying as Aboriginal or Torres Strait Islanders. 12 are currently enrolled trainees, will graduate in 2024. And MLHD will recruit 34 further positions in 25-26, and 12 of these will be Aboriginal and Torres Strait Islander applicants. So here in Murrumbidgee Local Health District, we focus on our future with a promise to our community which is articulated in our vision. Exceptional rural healthcare, healthier together, care tailored to people's needs. Our 4 priority areas provide a structure to our future focus: holistic health and wellbeing, lifting health outcomes, locally led reform, and workforce at its best. Safety and quality. What does this mean for us? Our board is dedicated not only delivering safe, high-quality care for everyone, but also ensuring our services are accessible and equitable. The board was pleased to see the district awarded accreditation by Australia's leading healthcare accreditation agency, the Australian Council on Healthcare Standards. This sends a clear and powerful message that our organisation is committed to providing high-level healthcare with a continued commitment to quality improvement and safety. I know from my past experience as a facility manager, there is a major work in ensuring a facility is compliant with best practice policies and procedures. So a big thank you to our Chief Executive, Jill Ludford, and our Director of Corporate Governance, Jill Raymond, and all our staff for achieving that excellent result. The board was also pleased to see the district performing well with patient information survey results. Our hospitals were recognised for their outstanding efforts in the Bureau of Health Information Admitted Patient Survey in 2023. The survey reflects the experiences of 949 patients admitted to Wagga Wagga Base Hospital, Griffith Base Hospital, Deniliquin Hospital or Young Hospital during 2023. Overall, the majority of patients, 93% in fact, said the care they received while in hospital was very good or good during this period. A majority, that's 95%, also rated the nurses who cared for them as very good or good, while 94% rated the doctors who cared for them as very good or good. The majority of patients, 85%, say they were always treated with respect and dignity, and 83% said the health professional were always kind and caring towards them. The board is committed to managing resources wisely to ensure sustainable services that provide the best return on investment for our community. This commitment to fiscal responsibility ensures or enables us to allocate funds effectively to essential services, ensuring patients receive necessary treatments and preventative care. We continue to support investments in virtual care, which brings healthcare closer to home, reducing travel needs of our patients and promoting the use of innovative digital technologies. We are excited about the emergence of the Murrumbidgee Health and Knowledge Precinct and the successful showcase event earlier this year that celebrated research, innovation and partnerships. We eagerly anticipate the future developments from this initiative. We are also committed to environmental sustainability and having a net zero carbon footprint. Guided by its own strategy, we are making progress, but still need much work to do. Guided by a newly appointed sustainability lead, Kim Whitney-Soanes. Aboriginal health remains a priority for Murrumbidgee Local Health District as we strive to close the gap for our First Nations people. We are actively seeking authentic connections with Aboriginal communities to collaboratively improve health outcomes and ensure equitable access to acute healthcare services. This year we are proud to report the highest intake of Indigenous new nurse graduates, along with successful Aboriginal workforce forums that foster networking, cultural support and professional development among our First Nation staff. This year the board created the MLHD's subcommittee, which is the Aboriginal Health and Wellbeing Committee. The committee is instituted to provide strategic and cultural advice to the MLHD board and chief executive in regard to MLHD's strategic direction to provide safe, accessible and responsive healthcare for First Nations people. It will lead and guide efforts to improve health outcomes for Aboriginal populations across our shared boundaries. Together, we are paving the way for a healthier future for our community. Thank you for your continued support and commitment to our mission. Let's work together to make exceptional healthcare a reality for everyone. I acknowledge the ongoing success of the district under the leadership of Jill Ludford as Chief Executive. Jill has just completed 10 years as Chief Executive, a significant milestone in itself, only amplified by the outstanding performance of the district during this time frame. It now gives me great pleasure to hand over to MLHD Chief Executive Jill Ludford to present on the district's achievements over the past 12 months. Thank you, Jill.
Thank you very much, Adrian, and good afternoon, everybody. I too would like to pay my respects to Elders past, present and emerging, and thank you very much, Auntie Cheryl, for our wonderful welcome to country. As Adrian said, my name is Jill Ludford. I feel a little bit embarrassed now and a little bit old, having been Chief Executive for 10 years. But what I can say, as I have the pleasure today of talking through some of our achievements over the last 12 months, is that we are in a very different environment than we were 10 years ago. This year has been a year both of growth and innovation. It's also been a year of challenges and resilience. And today I'm really pleased to share with you some of the initiatives that we have achieved over the year. It's been a year of building both bricks and mortar, and bricks very much I'm going to talk about some of our infrastructure projects that are building on across the district, and mortar is our people. It's our wonderful communities and, of course, our staff. I'm also going to start off by talking about some of the Aboriginal health initiatives. I want to acknowledge that Aboriginal people are the first peoples in Australia, and they have strong cultures and strong communities. However, there are large disparities in their estimated life expectancy compared with non-Aboriginal people. And we in the Murrumbidgee Local Health District are really committed to working in collaboration with Aboriginal people, with Aboriginal community-controlled organisations to improve health, well-being, and their emotional and social well-being as well. I want to talk about a wonderful initiative that is actually part of Living Well Your Way, which is something that we call collaborative commissioning, which was a wonderful opportunity that Murrumbidgee had through New South Wales Health. It's called Murrumbidgee, I Breathe, I Live. And it was a project that was co-designed with Aboriginal people in Griffith and also delivered in collaboration with the Griffith Aboriginal Medical Service. Very, very important to have rehabilitation in pulmonary and cardiac diseases. It is one of the evidence-based practices that we know will help people to manage their disease and keep them out of hospital. So this wonderful co-design program looked at personalising plans for First Nations people in exercise, understanding their condition through clinical yarning, storytelling and culturally appropriate activities, and also some practical support such as transport so that we could actually ensure that people could come. The approach created a really safe place, increasing the engagement and participation of our First Nations people and helped keep people out of hospital, and again, really important part of early intervention. So thank you very much to all who are involved. I want to also just touch on another one which is really important, which is about breast screening. Breast cancer, we know, is the most common cancer for Aboriginal women, yet their breast screening rates are lower than for non-Aboriginal people. This project aimed at increasing participation amongst Aboriginal women and was first started in Albury and Deniliquin by offering a really positive experience to overcome fears and to encourage regular screenings. Once again, it was about listening, understanding and working in collaboration with Aboriginal people to design a screening experience that suited them. It was also really important that we looked at collaborating with others, and in this case we collaborated with Support the Girls, which is an amazing Australian-owned charity which worked in collaboration with us. The results are outstanding. We provide breast screening right across the southern part of New South Wales, and I am very proud today to say that our Aboriginal participation rate is now over 50% compared to 44% statewide. I'm going to move on now and talk about some of our infrastructure projects. I'll start with one of our challenges, key worker accommodation. So we recognise the challenge of attracting people to come and work in our rural communities. And over recent years, like right across the sector, not just in health, we know that there is a shortage of housing stock for people to come and live in rural towns. We were fortunate to be part of a project from the New South Wales Government where 3 local health districts were allocated $45 million together to build pods on site at a number of hospitals. So I'm pleased today to advise that the prototype pod, which we watched being built off-site throughout the year, has now been delivered first of all to Finley, which was really exciting, and West Wyalong actually was the first to receive theirs. They had 3 pods which have now been handed over and are available for occupation. Finley was next. They have 6 pods that are currently being built on site, and we also have Narrandera, and I had the opportunity to have a look at those pods the other day, and they're under construction. They're brought in on the back of a truck, but there's still quite a lot of work to connect them to services and to do the landscaping around them. Additionally, at Narrandera Hospital, we've been able to upgrade some of the accommodation that was already on site, which is really providing additional support, not only for new staff, but also for students and others who, like agency nurses, who might need temporary accommodation. Griffith Base Hospital is a super exciting project for all the people in the Griffith region. It is our second largest hospital in the Murrumbidgee Local Health District, and it is an absolutely beautiful state-of-the-art facility. Had the pleasure of walking around it with the Minister for Health and the local member Helen Dalton recently, and we had a look in a number of wards, and it is absolutely sensational. Will really provide state-of-the-art facilities and provide additional access for specialist care in that region. The surgical areas, the critical care areas, intensive care, ED, are absolutely fantastic, and it has expanded medical imaging, a new cafe and continuation of an area for the United Hospital Auxiliary. And it's bringing all of those services that are currently in different buildings across the site under one roof, including our outpatient clinics, renal dialysis, cancer care and hospital in the home. So we really look forward to seeing that being completed early next year, and it will take us a few months then to commission. But when we're standing here next year, Griffith Base Hospital redevelopment will be continuing with the next phases, but we will be in the hospital. Two other projects, great to see our district hospital starting to see some capital injection as well. So the community of Temora very excited for their $95 million project. Absolutely outstanding community consultation and collaboration in all of the planning processes. They have just given their feedback on the schematic design, and really exciting now that construction is due to start mid-2025 and expected to be completed by mid-2028. Again, that acute hospital will help take the pressure off Wagga Base Hospital and provide acute care services for the region. Finley Hospital, on the other end of our district, was identified by the board quite a number of years ago. We've had it in our asset priorities because it was a smaller facility that really needed injection of capital to make it functionally workable. And so it's been really wonderful that we'll see that project also progressing now. We'll deliver a building that will be able to provide care in contemporary standards. Expanded reception area, again, newly located medical imaging area, upgrades to the ED and the wards. Construction is due to start early next year, so all exciting for the community there, with their pods also currently under finalisation, and it will be finished in 2026. So we are really fortunate to see that continued infrastructure development across our region. Adrian touched on workforce. I have to say it remains our largest challenge, and I think workforce challenges in regional areas are not just in healthcare. It is also seen across other sectors, but it is our largest challenge. Through the Murrumbidgee Health and Knowledge Precinct, we're taking a different approach. I'm only going to talk about one of them today, but I just wanted to let you know that we are looking at an integrated strategic approach to solving these complex workforce challenges. There are many pieces of the puzzle that we are working on at the same time. We have to look at the pipeline from student intake to student participation through to completion of tertiary studies. We need to look at postgraduate education and training. We need to look at professional development for staff. We need to look at how we recruit people to our rural areas, but most importantly, how we retain them to live and be part of our local health district. Wanted to talk about something different that we have done this year, which is our concierge service, and acknowledge Christine Stevens, who did a wonderful overseas recruitment campaign of 84 new nurses, all coming to our region in the last 12 months. They've all arrived and are settling into your communities. But it's quite a big event coming from overseas and coming to Australia. And we had a wonderful concierge who helped not only with those employment strategies whilst we were working through them arriving and all those logistics, but also really helped with practical things like travel, airfares for families, car hire, school enrolments, how to get Medicare, driver's licence, all those things, super important. So there was our smiling concierge meeting people at the airport and driving them to their new town and introducing them. Alongside that, New South Wales Government actually had a Welcome Experience project running in a couple of our towns, and I want to acknowledge Regional Development Australia, who worked in collaboration with us. This was another opportunity in Griffith and Corowa where we had connectors based in those communities who did a very similar concierge process to the one that I just described for our overseas trainees. Basically, we're helping people to relocate, We're helping people to settle in, and we're helping them to become one of the locals. Moving on now to some celebrations that we had across the year. We had an amazing year in last year with winning the New South Wales Premier's Award for the highest quality healthcare category. I'm so proud of the Murrumbidgee Rural Generalist Training Pathway, where we didn't accept the declining GP numbers, we did something about it. In rural, for rural, by rural, we employed GP trainees as members of our staff to work across hospitals and the primary health GP practice space and help them on their fellowship journey. This project has now been accepted by the Australian Government as a pilot and is being rolled out across New South Wales with 80 trainee places. We also, in the local awards in New South Wales Health, picked up the award for the same project, and our fantastic breast screen colleagues that I just talked about, they picked up an award for bringing assessment to rural people by assessment services going along in the van with their screening staff. And of course, to acknowledge the wonderful Sid Dudley, who won the Volunteer of the Year. Sid is the most extraordinary gentleman, kind and compassionate and giving. Sid comes from Finley and for many years has been the chair of the Local Health Advisory Committee. Sid, we owe you so much and thank you for all you do for the Murrumbidgee Local Health District. I'm just going to finish now. We're going through some of the clinical work that we've been doing. I just want to touch on chronic disease because chronic disease is probably the most critical disease facing our nation and causes significant disability and high levels of hospitalisation. So really across Australia, people of all ages, 61% of people in Australia are living with at least one chronic disease. We need to think about what that means for us as deliverers of healthcare going forward. So increasing and improving access and equity is the biggest challenge in a rural area across 126,000 square kilometres. We should not expect that people have to travel many hours to receive specialist care or assessment. So we have piloted over the last 2 years what we call our Outreach Heart Failure Diagnostic Clinic, and we're about to embark on the same thing for respiratory disease. It's very much a collaborative project. It is delivered in collaboration with the Primary Health Network in Murrumbidgee, with GP practices, but also with a number of other providers, including Roy Cardiology and Riverina Cardiology. So we pack up the specialist cardiologist or they attend virtually, the sonography equipment, the multidisciplinary team, and we go into general practice and we see prioritised patients and give them access to early diagnosis and self-management plans. And of course, at the same time, upskilling our GPs. So we've had 16 clinics held: Hay, West Wyalong, Lake Cargelligo, Temora, Narandra, Tumut, and Holbrook. So wonderful opportunity to bring services to communities. I see Professor Len Bruce sitting here in the room with me today. He has also led another fantastic initiative, the Rapid Access Clinic at Wagga Wagga Base Hospital, which is an alternative to ED, but also combines other services such as hospital in the home and a space where people can have other procedures such as infusions. It is a wonderful success because it is taking the pressure and demand off our emergency department. And it is a model where GPs work alongside a multidisciplinary team for patients who have got that non-critically urgent requirement, often requiring imaging or pathology, where they can be seen in a timely way and then handed back in a warm transfer back to their own general practitioner. Very engaging with our First Nations consumers, and also this year was expanded out to paediatric mums, dads and children. So a really fantastic initiative. I'm going to finish off on the Health and Knowledge Precinct, actually, as Adrian did. We are very proud to partner in the Health and Knowledge Precinct. It is next level because it combines education, research, innovation and integrated service models. We are only but one because we work alongside universities, the private sector, not-for-government sector, and also with industry. It's a huge opportunity for our region, who have an enormous energy for collaboration, and for us to together address some of the more wicked problems that once would have sat in siloed clusters. So we're working on 3 goals. We're working on enhancing research and innovation. We're working on workforce solutions, and we're working on service integration. By that, I mean the fact that we have so many different funding sources for different health services, and how can we bring them together so that it's easy for people to navigate. So thank you all very much for listening to the challenges and the successes that we are addressing, and the incredible work that has been done by our teams, our patients, and the entire community. 3 thank yous. My hugest thanks, with enormous gratitude, to all of the staff who work across the Murrumbidgee Local Health District. Every day, across 24 hours, you work tirelessly for people, to care compassionately, and I want to thank you so much from the bottom of my heart. I extend also my thanks to the board for their incredible support and guidance throughout the year. The board is a skill-based board and provide a lot of support, as well as, of course, the compliance requirements of their job, but guide us in making decisions as we move forward. Finally, I want to thank all the volunteers. We have many volunteers from the United Hospital Auxiliary to the local health advisory committees, and many other volunteers who work in a number of ways from Wagga Base Hospital and our multi-purpose services. Thank you for your compassion, your kindness and your generosity, because what you do makes an enormous difference to our patients, our staff and our communities. Thank you. I'm now going to hand over to Bridget Burke, Associate Director of Finance and Performance, to take you through our end of financial year update. Bridget.
Thank you, Jill. Here we are. I'm not the Director, I'm the Associate Director of Finance and Performance. Okay, so how we afford to provide all these services. We finished 23-24 with a net surplus of 3.9 million, which net surplus is measured by revenue less expenses. While we were in the positive, 3.9, we were actually budgeted to deliver 12.4 million as a surplus, so we slightly overspent. We had an expense budget of about 852 million. We spent over that amount by 59.9 million, so we roughly spent about 912 million delivering health services. Our revenue budget of 866 million, we were favourable. We delivered more than that revenue, up by 47.3 million, and so we ended up earning about 913 million. So in terms of sort of like the really large amount of money that we spend, we spent around about 483 million on employee-related expenses. That was an increase of 26 million, or 5.4% increase. You'd expect it to be around at least 3%, because that was the awarded increase. But there are other factors influencing our employee-related expenses other than pay rises. Our visiting medical officer payments, they increased by about 10 million, mainly due to we had a deferred care surgery program, which was catching up with our elective surgery wait lists, and also we expanded the virtual VMO care to our rural and remote facilities. Our operating expenses were 25 million more, which was a rise of 8.6 million compared to last year. That was spent mainly on capital, so replacing equipment or repairs and maintenance, residential accommodations. So while we're waiting for these lovely pods, we've been leasing accommodation for staff to stay in. Agency costs, what we pay employment agencies to provide our premium workforce, and ICT costs, the the growing cost of activity of ICT infrastructure. In the revenue space, it's a bit different from what it was in previous years. They've separated out what the Commonwealth funds us under the National Health Reform Agreement. That's now part of our grants and other contributions amount, which was about 264 million of that 281 that we're talking about. Sale of goods and services, 116 million. We increased that by 12.3%. That was mainly down to pharmaceutical sales, so basically high-cost drugs that we get funded from the Commonwealth, patient fees, aged care, and income and infrastructure fees. So 112 million of that 116 was patient fees, and 50 million of that related to nursing home type patients and transition care on the Commonwealth. Our statement of financial position, or our balance sheet, we've got increased assets, you can see in 2024. That's mainly down to all the infrastructure investment that's incurred in Murrumbidgee. And the liabilities, they shot up in 2024. That was mainly due to a change in accounting treatment, so bringing on paid parental leave as a provision. Okay, with our activity, what we're actually paying for, we get funded on the basis of providing national weighted activity units. So what that means is the government purchases activity that's weighted to reflect the complexity of the activity. So, heart surgery is worth a bigger weighting than, ingrown toenail removal. The MLHD exceeded what the government wanted to purchase from us by 3.1%. We have our NWOW split into different streams. So we've got the admitted activity, we've got emergency department activity, and we've got non-admitted activity. So the acute admitted is what you tend to think about when you think about hospitals, and that's one of the areas of the greatest growth. A lot of that is also contributed to by the deferred care surgery catch-up. People go into hospital for their surgery. ED is also increased. It was 19% of all of our weighted activity, and we were also above what we were paid for. So in terms of sort of like our activity, you can see from the year-on-year comparison that we, kind of looks like a lopsided smile, that we had sort of like activity up in 2019, it dropped off in the middle years, and then it's been recovering 23 and 24. And you can see there sort of like we've got a split of where the variance to target is, and the target's what we're paid to deliver. Our workforce, here's the split of the activity in terms of the pie. You can see that acute is the major component of our activity, followed by ED and our other activity. And there's our lopsided smile. So workforce, we measure workforce by full-time equivalents. So in health, we have a lot of people working for us. Our head count of staff is a lot more than what our full-time equivalent is. Full-time equivalent is basically looking at the standard hours a person works and measuring it as one full-time FTE. So a nurse has standard hours of 38. If they work 38 hours, they are one FTE. If they work 19 hours a week, they are 0.5 of an FTE. So we measure our FTE, our workforce by FTE. We have seen a steady growth in our workforce. So our staffing levels have increased by 2% compared to last year. And this is across most groups that we have. However, it does include also what we call premium labour, which is essentially agency staff and overtime. So they're staff that we're paying more for than we would if we just had a standard arrangement. So you can see that everything's measured against 2019 as if that was a perfect time in place, you can see that it's actually grown up to 2024. And that's our challenge around workforce in terms of sort of replacing that with recruited staff. You can see that sort of we have the admitted patient activity. As I said, that's generally what you think about when you think about a health service. In terms of our occupied bed days, you can see that sort of they've risen up to 2024. A lot of that is again influenced by the deferred surgery program that we had. And we've had growth obviously in services like renal by 54.3%. But in those areas growing, we've also had a drop-off in different areas. Again, surgery levels are up by 2.1%, and that has a lot to do with the deferred surgery program. Our ED, on average, there's 445 ED presentations per day in MLHD. In terms of the actual spread of emergency presentations, 30% of them are seen at Wagga Base Hospital, 56% at the non-base hospitals and 14% at Griffith Base Hospital. Despite the non-base hospitals being 56%, they're roughly still below presentation levels before COVID, and Wagga has certainly grown in that time. But you can see that sort of like we've got a smile again, dropped off in the COVID years. The triage levels of people presenting to ED, we have seen growth in triage 2, 3 and 4, with triage 5 holding stable over the last 2 years. Non-admitted care. So our virtual health occasions of service have grown. You can see in 2022 that they were quite high. That was a combination of COVID in terms that we wanted to provide virtual care. They've also grown, as I mentioned, with the virtual doctor service that we provide to rural and remote facilities. With the non-admitted occasions of service, they have also grown. They're a lot higher than they were pre-COVID in 2019, which reflects a better area of health for people not having to be admitted to hospital to seek care. And just with 2024-25, we've started the year with an initial budget allocation of 843 million, which is an increase of what we started with last financial year of 62 million approximately. You saw from the first slide, we actually ended up spending we had a budget for about 852 by the end of last year. That's because we do get amounts of budget provided to us throughout the year from government, or we actually earn the revenue that increases our budget. And our own sourced revenue, which is the revenue we have to collect apart from the money that the Ministry of Health give us to provide services, that has been increased by 37.5 million, but that also includes the National Health Reform money from the Commonwealth Government that's now part of the grants and contributions figure. And the 2023-24 audited financial statements are available on our website. Thank you.
Thank you very much, Bridget. Much appreciated. We're going to go now to questions that we have received to discuss today. And the first question, we've obviously got somebody listening online who's given some feedback about one of the project I talked about, the I Live, I Breathe. And the person says, my husband was a participant in I Live, I Breathe program in Griffith, which was a fantastic program delivered in a culturally safe and appropriate way. Particular thanks to Fiona McKern for her ongoing above and beyond for all of those she supported to attend. Her additional care was greatly appreciated, and Fiona McKern, an absolutely outstanding person who was part of our Living Well Your Way. The person who's written the question has also gone on to say, is there any update on the Lake Cargelligo MPS upgrade yet? So for those of you who may not know, Lake Cargelligo had a health service plan developed in collaboration with the community, an outstanding process, again, extraordinarily collaborative, and the plan describes something that's quite unique, which is an MPS, which is culturally safe for Aboriginal people. And it is sitting there, isn't it, Adrian, our asset strategic plan as right up there in the top priority for consideration by the New South Wales government for infrastructure funding. So we haven't got any other announcement that we can say to you today other than that it remains in our asset strategic plan as a priority. The second question actually comes from the Narrandera Shire Council Mayor, Neville Shukenta, and he's got a couple of questions here. I'm going to answer one part myself, and then I'm going to ask Professor Len Bruce and Christine Stevens to come forward. So his question is actually about workforce, and his question goes, what is your solution to the nurse shortages at Narrandera Hospital that is putting the future hour of emergency services at risk? The second part of his question is, we need faster approval for overseas trained doctors to elevate shortages at our medical centre. So I'm going to start off by talking about nurses, and Christine, I'll get you to come forward so you can talk about how we upskill nurses to work in the emergency department. One of the challenges we have in rural healthcare delivery is that our nurses are actually highly specialised. Working in any of our 29 facilities, they need to be able to look after a whole range of ages and stages, from paediatrics, aged care, trauma, but working in the ED really does require advanced life support skills. And so I think that's probably one of the key factors why it is so challenging for us to recruit nurses to work in rural New South Wales, because like a lot of the medical professions, nursing now is becoming highly specialised. And so Christine's going to talk about a program that we have developed to train rural nurses to be rural specialist nurses. But Neville, just in response to our immediate urgent need for Narrandera Hospital right now, what we are able to offer for people who are interested in working in your beautiful town is incentives under the New South Wales Rural Incentive Scheme. And there are incentives available between $5,000 and $20,000 for people to come and work in the rural regional area. We also offer accommodation for people to come, because we recognise finding a suitable housing can be very challenging. For people coming overseas, and even though Christine completed that overseas recruitment last year, it is ongoing, and we are continuing to bring in people from overseas, particularly UK and Ireland, and we continue to offer that concierge service, which is really, really important. And again, that visa management is highly complex, and again, us covering those costs is really important, and we do that in-house, so we've developed those skills. Christine's going to talk to you now about the ED upskilling, which is probably a reason why some nurses may not be applying to work in Narrandera Hospital, because they may not have those advanced life support skills. And she's going to talk to you about that virtual nurse assist program that she has developed unique to the Murrumbidgee Local Health District, and a little bit about the new graduate program and our collaboration with Charles Sturt University. Thank you. I'll then get Professor Bruce to come and answer the questions about overseas medical trainees. Thank you.
Thanks, Jill, and hello to everyone this afternoon. Just sharing our commitment from the Board Chair, Adrian, and Jill, our Chief Executive, I'd just like to say that Murrumbidgee is committed to providing high-quality, safe care in our emergency departments at Narrandera. A part of doing that is supporting our frontline nursing staff through what's a program called the Virtual Nurse Assist program. The Virtual Nurse Assist program is a 24-hour, 7-day-a-week support, virtual care by experienced clinical nurse consultants located in our virtual care centre here at Wagga. They provide support to all our frontline nursing staff in district and MPS sites, and they will actually guide those nurses through triage, assessment, treatment and care within the emergency department. The majority of these clinical nurse consultants have a background in acute care, critical care, so they've worked in emergency departments and ICU, and they have the skills to train and educate people through virtual technology. We also have a commitment to, growing our future workforce, and we're pleased to say that we're partnering with Charles Sturt University on a rural generalist nursing program. The rural generalist nursing program allows for us to grow our workforce for the future in rural healthcare. So what we are doing is we're recruiting 10 nurses in each first year and second year. They're undergraduate students. They'll come to work with us in Murrumbidgee. They'll do their clinical placements with us. We'll help them to develop a very broad set of skill sets that will enable them to work in rural regional healthcare and be nurses that can work across the spectrum of emergency acute care and aged care services. And this will enable us to strengthen the quality of those nurses as they come out as a graduate and continue employment working in Murrumbidgee. We'll also employ them in the second and third year as assistants in nursing, and they'll have access to further education not only through the university but with Murrumbidgee Local Health District providing the Rural Generalist Training Program and some other advanced life skill support that we will give them so that when they come out they're work ready and they're able to support our clinicians and, more importantly, the patients and our community at the healthcare services that they access. So it's a really exciting time for Murrumbidgee embarking on that future focused grow your own strategy. In addition to that, we also have developed the Rural Generalist Nurse Practitioner program. I'm pleased to say that Narrandera has one FTE of a nurse practitioner rural generalist within the cluster, and we are currently recruiting to the second rural generalist nurse practitioner for that cluster as well. Those rural generalist nurse practitioners work across a meta-speciality. That includes emergency department, mental health. It includes primary care, chronic and complex, and family and child health. And it really does enable us to strengthen that equity and access of healthcare for those communities living in that Narrandera cluster. And I'm pleased to say that we've been able to actually develop those rural generalist nurse practitioners across the whole region of Murrumbidgee Local Health District. But I hope that points to you the strength and the commitment we've got to grow our own and develop our staff and encourage people to work and stay working and living in Murrumbidgee. Thank you, Jill. I'll just hand over to Len Bruce.
Thanks, Christy. So I actually have some good news in terms of the recruitment of overseas trained general practitioners. On the 21st of October, the Medical Board actually announced an expedited pathway where general practitioners from the UK, Ireland and New Zealand can actually apply for registration with APRA. In the past, the process was that before you could register, you'd need to apply to a specialist college, and those applications could take quite some time. So that's good news for us. My understanding is that that process will be expanded to other specialty areas, including O&G and psychiatry. So other strategies that the LHD can support is to provide doctors with placements in base hospitals, especially if they've not had any Australia or New Zealand hospital experience. We can offer temporary contracts. So we have a medical and dental appointments advisory committee that oversees all senior doctor appointments to make sure that our communities are safe, and we also look after the medical staff. That committee meets once a month, but if we have a suitable applicant, we're actually in the position to offer a temporary contract while we go through that formal process. The other support that we can provide is obviously growing our own, and that's the Murrumbidgee model or the single employer model, and then obviously also supporting our medical staff with the remote medical consultation service, the critical care advisory service, and our great nurse practitioners. Thank you.
We're just looking at a question that has just come in online that Christine's just having a read of, and she's going to come up. It's actually a question about the 482 visa. So thanks, Chris.
Thank you, Jill. We just had an inquiry just about access for 482 visas for enrolled nurses. So we currently have escalated an issue around access to 482 visas with the Ministry of Health and Department of Home Affairs. Currently, there has been a change this year to access to visas for staff. It is currently capped at just over $72,000 is the minimum salary people can earn before we can actually get people access to a 482 visa. It is a challenge for us because the enrolled nurse salary is just below that $72,000. What we are going to be doing is monitoring the current ward negotiations and looking at how the salary goes in terms of where the final payments look at, whilst we wait advice from Home Affairs around access for enrolled nurses into a 482 visa. So we're actively working with the Ministry and Home Affairs, and as soon as I have any other updates, I will let you know as soon as possible. Thank you.
Thank you very much, Christine. And if anybody else has any questions that you would like to send in, please have a look on our Murrumbidgee website and you'll find the feedback link there, and you can certainly submit further questions which we will respond to. So we're going to move on for the final part of our presentation today, which is actually the presentation of what we call the Don Kendell Award, which is the pinnacle award for the Murrumbidgee Local Health District in recognition of leadership. So Don Kendell was a gentleman who lived in our region, who some of you might recognise. He was actually the chairman of the Greater Murray Board, but he was absolutely dedicated to improving healthcare for the region, and his pioneering spirit and his innovation and determination helped to establish one of the first regional airways in New South Wales and Australia. So we have for a number of years now recognised people who are leaders in their field, who go above and beyond, who have that pioneering spirit to want to achieve more. So I want to read out today our finalists in the Don Kendell Award Leadership Award, and then we're going to announce the winner. So this award honours those who inspire others to achieve excellence, to foster a positive and collaborative work culture, and lead with integrity and vision. The finalists this year have set remarkable examples on how exceptional leadership can drive meaningful change and improved access and equity to health services in our region. The finalists for the 2024 Don Kendell Memorial Leadership Award are Connie Bostock, who is the Education and Development Facilitator for the Murrumbidgee Local Health District, Leanne Horn, Executive Assistant to the General Manager at Wagga Wagga Base Hospital and Secretary to the Wagga Wagga Local Advisory Committee, Jane Bonney, who is the Nurse Manager for Aged Care, Sandra Ford, who is the Midwifery Manager for the midwifery stream across the district, and Wendy Skidmore, who is the facility manager at the Temora Hospital. The individuals nominated for this year's award have demonstrated a deep commitment and passion for their roles, their region, and for rural health. And it is a real reflection on the values that Don Kendell demonstrated across the region. And it is my great honour now to announce the winner of the 2024 Don Kendell Award, and the winner is Sandra Ford. I'm just going to read a little bit about Sandra while she collects herself. Sandra and I are both midwives, so we share a connection. And before I read out Sandra's extraordinary achievements, I was just thinking, Sandra, as I watched your face then, that you started in your role the same time I started as Chief Executive. And early one morning, down by the lift, we looked at each other and we said, we don't care, we are going to deliver a maternity continuity of care model no matter what it takes. Well, Sandra, it's taken 10 years, but one of her achievements is that we are nearly there, a consumer-designed continuity model of care for our people. I'm going to read you about Sandra, but before I do, I just want to acknowledge all of the other finalists. They're all extraordinary leaders, and the three judges had a very, very difficult job selecting a winner. In actual fact, we could have given a Don Kendell Award to all of them. So I just want to ask you to please put your hands together for all of our finalists. Now, Sandra, nobody likes hearing a little bit about what people wrote about you, but this is what they wrote about you. Sandra's leadership journey spans over 30 years, beginning in 1990, and includes significant experience in both clinical and academic sectors. Her career has taken her from grassroots practice to management roles, and she has held positions such as a statewide midwifery specialist for the New South Wales Referral Advice Line for maternal and neonatal transfers. She is known for maintaining her clinical practice by working weekends in health while managing a full-time role in the university sector and also while balancing family commitments. Since becoming the district midwifery manager in 2014, Sandra has continuously demonstrated her passion for evidence-based, woman-centred maternity care. So put your hands together for Sandra. I'm going to ask Adrian to come forward and help me lift the eagle because it is extraordinarily heavy. But in the meantime, Sandra, I'd like to present you with this award.
Thank you, Jill.
And Adrian's managed to lift the whole thing. And I'll let you present.
Congratulations.
Thank you.
Sandra, well done.
Thank you.
Really.
Thank you, Adrian.
And Sandra, we're going to invite you to say a few words.
I thought that would be next, Jill. Thank you. It is an honour to receive this award. I am a local and grew up in Wagga in the 70s and 80s when Don Kendell was starting up his airline. And it really is an honour to receive this in his name because he was a man who was very community focused, he was very resilient, and he also stood for his integrity and his devotion to the community. I'm absolutely honoured to receive it. I also just want to acknowledge the clinicians across the maternity services who, midwives, doctors, sometimes work in very difficult circumstances, and they're very devoted to the women they provide care to and to also the communities for which those women live. Jill, I also want to acknowledge the nominees. I'm in a very good crowd, can I say. They are strong women who demonstrate our core values at every turn, and I admire each and every one of them. Thank you.
So that concludes our presentations today. I'd like to thank each and every one of you for joining in and listening, those of you who are in the room here and also those of you who have joined us online. Thank you very much and good afternoon.